What is nitric oxide's surprising role in asthma airway regulation? Imagine a tiny gas that can both help you breathe easier and cause more breathing trouble. That's what nitric oxide does in the airways of people with asthma. It's a bit of a puzzle. On one hand, it relaxes muscles in the airways, making it easier to breathe. On the other, when produced in excess, it can lead to inflammation and damage that makes breathing harder. Nitric oxide is naturally made in our airways by special enzymes called nitric oxide synthases. In healthy lungs, it helps keep the airways open by activating a molecule called soluble guanylate cyclase. This leads to increased cyclic guanosine monophosphate, which relaxes the smooth muscles around the airways. So, nitric oxide acts like a natural bronchodilator, helping to prevent or reduce the feeling of shortness of breath. But in asthma, things get complicated. The inflammation in the airways causes an increase in a specific form of nitric oxide synthase called inducible nitric oxide synthase. This produces large amounts of nitric oxide, which can turn into reactive nitrogen species. These molecules can damage the tissues lining the airways and promote oxidative stress. This damage leads to airway remodeling, which means the airways become thicker and narrower, making it harder to breathe and worsening symptoms like shortness of breath. Nitric oxide also interacts with common asthma medications that target beta-to-adrenergic receptors. When these receptors are activated, they help relax the airways. Nitric oxide produced in response can help with this relaxation. But if too much nitric oxide is made, it can inactivate these receptors, making the medications less effective. This can cause the airways to constrict again, creating a cycle of difficulty breathing. Doctors measure the amount of nitric oxide in exhaled air to see how much inflammation is present. Higher levels usually mean more inflammation and airway hyperresponsiveness. When patients use corticosteroids, which reduce inflammation, their nitric oxide levels tend to go down. This measurement helps doctors decide how well the treatment is working and if adjustments are needed. So, nitric oxide plays a dual role in asthma. It can help open the airways and make breathing easier, but when produced in excess, it contributes to inflammation and airway damage. Understanding how this tiny gas works helps us better manage symptoms like shortness of breath and develop targeted treatments to keep the airways healthy.